What genetic mutations cause TB bacteria to resist antibiotics? Imagine a tiny bacteria that can change its own genetic code to survive powerful medicines. That's what happens with tuberculosis bacteria when they develop resistance to antibiotics. These bacteria are called Mycobacterium tuberculosis, and their resistance is mainly caused by specific genetic mutations. Understanding these mutations helps doctors diagnose resistant TB faster and choose the right treatment. Antibiotics work by targeting key parts of the bacteria, like their cell walls or the machinery they use to make proteins. The most common TB drugs are called first-line drugs, including rifampin and isoniazid. When TB bacteria are exposed to these drugs repeatedly, or if treatment is not completed, mutations can happen in their DNA that make the drugs less effective. Most resistance comes from tiny changes in the bacteria's genes, often just a single DNA letter change, called a point mutation. These mutations can change the shape of bacterial enzymes or proteins so that antibiotics can no longer bind properly or work as intended. For example, resistance to rifampin is usually caused by mutations in a part of the RPHB gene. This gene produces an enzyme that rifampin targets to stop bacterial growth. When a mutation occurs in the rifampin resistance-determining region of RPHB, the enzyme's structure changes. As a result, rifampin can no longer attach, and the bacteria keep growing despite the medication. More than 95% of rifampin-resistant TB cases are linked to mutations in this specific gene region. Isoniazid resistance is a bit more complex. It often involves mutations in the CAT-G gene, which encodes an enzyme needed to activate isoniazid inside the bacteria. If the CAT-G gene mutates, the enzyme no longer activates the drug, making it ineffective. Another common mutation occurs in the INHA gene's promoter region, which causes the bacteria to produce more of the target enzyme, reducing the drug's ability to work. Other drugs have their own specific resistance mutations. Resistance to fluoroquinolones, like ofloxacin, involves mutations in the GIRA or GIRB genes, which are important for DNA copying. Resistance to ethionamide can be linked to mutations in the ETHA gene, which helps activate the drug. Streptomycin resistance often involves mutations in the RPSL gene, which encodes a part of the bacterial ribosome. These mutations happen randomly, but they become more common when antibiotics are used improperly or incompletely. When drugs kill off the susceptible bacteria, the resistant mutants survive and multiply. This natural selection process leads to the spread of resistant strains. Modern molecular tests can detect these genetic mutations quickly, often within days. These tests look for changes in genes like RPHB, CAT-G, INHA, GIRA, GIRB, ETHA, and RPSL. Detecting these mutations early allows doctors to adjust treatment plans promptly, which is crucial for curing the infection and preventing the spread of resistant TB. It's important to remember that resistance is caused by specific genetic changes in the bacteria, not by the drugs themselves. Proper treatment adherence and completing the full course of therapy are essential to prevent these mutations from developing. If you suspect TB or have been diagnosed, always follow your healthcare provider's advice and get tested with advanced diagnostics to ensure the best possible outcome.